Today I'm going to be discussing the medicinal uses of silver and how, in rare cases, too much silver in your body can lead to a condition called Argyria. Back in history, silver was seen as a very unorthodox use for medicine, but now it has been known that silver is an antimicrobial, meaning that it kills microorganisms that may cause infection when a wound has been obtained. Now, in the production of many bandages that are used to help heal wounds, you will see a small percentage of silver within them to help fight with infections. Bandages are not the only way silver may be obtained to the body. Silver may be obtained through creams, supplements, particles within the air, and may be ingested. Argyria is a very slow progressing condition. Argyria progresses over a course of 6 months to several years. It is usually untoxic to the body, but it may lead to silver poisoning if the condition begins to worsen or the patient begins to use silver in an excessive amount consistently. When an excess amount of silver enters the body, small portions of silver particles may pass through the excretory system. The excretory system allows for too much silver to leave the body through typically urine. When small particles of silver pass through the excretory system, they typically land within the dermis or epidermis layers of the skin, affecting the coloration of the cells. When argyria begins to form, you will notice that the cells are changing in color. When put under light, you are able to see a blue or gray color. You may be wondering how you obtain a sample to test for argyria. Any sample is very suitable to test for argyria, either through a stool, urine sample, blood sample, or a skin sample. The sample is then put under a microscope and looked at closely. At first glance, you may or may not see the discoloration of the cell, but once exposed to light, you are able to see a change of color. Argyria is known to be more effective in places of the body that are more susceptible to sunlight. So, your face, your eyes, your nails, basically your skin. A case was reported of a 70-year-old man with a report of cyanitis. He was then referred to a dermatologist for a complaint of gray skin. He then reported that he did not use any drugs, but he was using a nasal decongestant. Within his decongestant, there was 10% silver, which he had been using for over 5 years. The argyria began to slowly progress throughout his body, but over those 5 years he was asymptomatic until he began to notice the gray discoloration under his nails, and his face began to change the same color. Once the doctor began to run tests, they began to get the suspicion that he had conducted argyria. Many cases are also asymptomatic for argyria. Again, it is not very toxic to the body and does not do much else besides change the color of your cells, eventually changing the color of your skin. There are different levels of argyria, some ranging from a discoloration of the cells/skin from being blue, black, or gray. Some argyria, if caught early, may be reversed, but it just basically... Some forms of argyria may not be from silver. Typically, a discoloration of the skin may be caused by heavy metals or metals in general. Other forms of argyria may affect the basal cell layer or the basal membrane of sweat glands. As of right now, doctors are not sure how much silver must be obtained to the body to start the progression of argyria. Because Argyria is such an unknown condition, there is no cure for it, so it may be considered irreversible.